CNA UTI Delirium Recognition. Welcome to the quiz. Question 1. A resident who is legally blind asks you to describe the view from their window. What is the best way to respond? Option A. Open the window so they can feel the air and hear the sounds, which is better than a verbal description. Option B. It's a nice day, and leave it at that, as detailed descriptions may be confusing. Option C. Provide a detailed, vivid description using other senses and descriptive words, such as, I can see the bright yellow sun warming the red bricks of the garden wall, and I can hear the birds singing in the big oak tree. The air smells fresh, like it might rain later. There are pink flowers blooming right outside. This engages their imagination and other senses. Option D. Tell them there's nothing interesting to see, so they don't feel like they are missing out. The answer is C. Rich sensory descriptions allow a blind person to imagine the scene. Option A is a good addition but does not replace a verbal description. Option B is too brief and dismissive. Option C is correct because it provides a rich, sensory description that allows the resident to imagine the scene. Option D is dishonest and may make the resident feel excluded. Question 2. You're about to perform a procedure. After identifying the resident by checking their wristband and asking their name, the resident says, "My name is Mary, but everyone calls me Susie." What should you do? Option A. Stop and do not proceed with the procedure. Report the discrepancy between the wristband and what the resident said to the nurse immediately. Re-identify the resident using another method, such as checking their photo in the chart, before continuing. Option B. Ask them to confirm their date of birth. If they can do that correctly, proceed with the procedure. Option C. Call them Susie to make them feel more comfortable and proceed with the procedure. Option D. Proceed with the procedure, noting that the wristband says Mary, but it's common for residents to have nicknames. The answer is A. Any discrepancy in identification must be resolved before proceeding. Option A is correct because any discrepancy in identification must be resolved before proceeding to ensure you have the right resident. Option B is incorrect because date of birth may be forgotten or confused. You need to resolve the discrepancy with the nurse. Option C is incorrect because using a nickname does not confirm identity. Option D is incorrect because assuming it's a nickname could lead to wrong patient error. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 3. A resident with a diagnosis of anxiety is pacing the hall and wringing their hands. What is a helpful nursing assistant intervention? Option A. Leave them alone to work through their anxiety, as interacting may make it worse. Option B. Tell them to sit down and relax, as pacing will only make them more anxious. Option C. Walk calmly beside them and engage them in non-stressful, neutral conversation about the weather, or offer them a simple repetitive task like folding washcloths or sorting socks. This can help channel nervous energy. Option D. Ask them directly what they are so worried about so you can help them problem solve. The answer is C. Walking with an anxious resident and offering a simple task can reduce anxiety. Option A is incorrect because leaving them alone may not help. They may need presence. Option B is incorrect because telling someone to relax often increases anxiety. Option C is correct because walking with them and offering a simple task can help reduce anxiety by providing distraction and channeling energy. Option D is incorrect because asking directly about worries may increase anxiety. Question 4. When providing perineal care to an uncircumcised male resident, what is the correct technique to ensure proper hygiene and prevent infection? Option A. Gently retract the foreskin as far as it will naturally go, clean the area underneath with soap and water, rinse thoroughly, and then gently return the foreskin to its natural position to prevent paraphimosis, swelling of the retracted foreskin. Option B. Use a cotton swab to clean underneath the foreskin without retracting it, pushing the swab gently into the space. Option C, clean only the outside of the penis, as retracting the foreskin can cause injury. Option D, retract the foreskin forcefully to ensure a deep clean and remove all smegma, then leave it retracted to air dry. The answer is A. Proper cleaning includes retracting and returning the foreskin to prevent paraphimosis. Option A is correct because it ensures proper cleaning of the area where smegma can accumulate, and returning the foreskin prevents paraphimosis. Option B is incorrect because using a swab may not be effective and could cause injury. Option C is incorrect because not retracting leaves debris. Option D is incorrect because forceful retraction can cause injury, and leaving it retracted can lead to painful swelling. Question 5. You are providing end-of-life care. The resident's respirations are very noisy, often described as a death rattle. What can you do to help ease this symptom and provide comfort? Option A. Position the resident on their side to help drain secretions from the mouth and throat by gravity. Provide gentle mouth care with moist swabs to keep the mouth moist. Reassure the family that this sound is common and does not appear to cause the resident distress. Option B. Suction the resident's mouth and throat frequently to remove the secretions causing the noise. Option C. Offer the resident a small sip of water through a straw to help thin the secretions. Option D. Tell the family to try to ignore the noise, as it means the end is very near. The answer is A. Positioning and mouth care provide comfort. Explaining to family reduces distress. Option A is correct because positioning on side allows drainage and mouth care provides comfort. Option B is incorrect because frequent suctioning can be traumatic and may not be necessary. Option C is incorrect because giving water to a dying resident may cause choking. Option D is incorrect because telling family to ignore is insensitive. They need explanation and reassurance. Question 6. A resident has a new cast on their lower arm. What is the most important sign of circulatory impairment to watch for and report immediately? Option A. The resident's fingers on the casted arm are pale, cold to the touch, and they report numbness, tingling, or increased pain not relieved by elevation or pain medication. These are signs of compartment syndrome. Option B. The resident says the cast feels heavy and uncomfortable. Option C. A small amount of dried blood on the edge of the cast from the procedure is normal and expected. Option D. The resident says the cast feels warm and itchy underneath. The answer is A. Pale, cold fingers with numbness indicate circulatory impairment, a medical emergency. Option A is correct because pale, cold fingers with numbness/tingling indicate impaired circulation, which is a medical emergency. Option B is subjective and not emergent. Option C is normal post-procedure. Option D is normal, itching under cast. Great job! Don't forget to subscribe. Bye.